and welcome to the Doctor Janine Show. I'm so happy to have you all here today. It's going to be a great show. We have some new topics, some of which we've touched upon a little bit before, but new things too. Okay, this is based on what you've asked for last week and the last couple of shows. Of course, we're talking about eye health today. So focusing in on specifically a clouding of the lens of the eye. Now, you know, if you've been diagnosed with cataracts, you know exactly what I'm talking about. I'm going to talk about my natural tips, how to actually prevent, but also see a clearing up of the lens of the eye. Yes, it is possible when we're talking natural tips that I'm sharing in today's show. So excited about that. Of course, you see the poop platter. How can we do a show without talking about healthy digestion, gut health? We will be focusing in on celiac disease today because, again, you as my followers have asked for me to cover that topic. So please say hello, where you're from. We're also going to talk, here's a little sneak peek, something that could be potentially healthy, but maybe impacting your gut health in a negative way. We will be talking about some of those foods, and I've got a big list of foods that are ridden with a particular herbicide, okay? So we will be talking about that, as well as we're going into the beauty set a little bit later. I know that you wait for that section of the show, talking about eyes and face taping for around the eyes for those crow's feet. We will be sharing that as well. Please say hello. We are also talking headaches today. So my tips for migraines. Okay, some of the causes, most common causes of migraines and what we can do about them naturally. That was another viewer request, something that we will be talking about. El Cato, hello from London, Ontario. Nice to have you here. Thank you for tuning in. And the Come Up 39 is here from Colorado Springs. Thank you and good morning. Thank you for tuning in. Rick from Tampa, Florida. Nice to have you here. I am MPS. Thank you. Nice to have you here. Thank you for tuning in. Sunshine Mumsy is here from Saskatoon. Good morning to you all. Thank you for tuning in today. Tita in Rialto, California. Thank you for tuning in. It's great to have you all here. Bella, hello. Hola. Nice to have you here. Kathy is here. Good morning to you, Kathy. Margaret as well. Kelly in Constantino, Upper Michigan. Thank you, thank you, thank you. And Jacinth is here from the Caribbean. Well, thank you for taking some time to learn today from myself, of course, naturopathic doctor. If you're new here, please hit that share button and follow. Make sure that you are subscribed so that you are always up on the newest and latest health information. Of course, from a natural perspective, that's what we do here at the Doctor Janine Show. I'm so happy to have you all here today. Larry is here as well. Bootsy123 in London, Ontario. Hey, a few people from London, Ontario here today. Well, hello, hello. Thank you for tuning in. Roberto from Mexico. Hola. Good morning. How do you say good morning? Oh my goodness. Hola. It'll come to me. Buenos dias. Buenos dias. Oh my goodness. I'm having some mental health issues? No, I'm just kidding. Okay, so we're going to start the show talking about our eye health. And this is something that, by viewer request, is something that you definitely want to learn more about how we can keep our eyes healthy. And let's go and talk about some of the causes of cataracts. So if you don't know what a cataract is, maybe you're experiencing some of the symptoms, and I'm going to go through those as well. I do have tips for migraines coming up in just a few moments, so stay tuned for that. Okay, so the cataract is a clouding of the lens of the eye. And of course, we need that lens to focus the light to the back of the eye so that we can see what we're looking at very clearly. Now, when we've got that clouding of the lens of the eye, which I want to tell you is preventable. So a lot of, people that are over the age of 50, 60, 70, 80, they are developing cataracts. It's one of the most common causes of a loss of vision with aging, but it's completely preventable, okay? So this is something that we have to educate so that if you are in your 20s, your 30s, your 40s, that you're not going to develop these cataracts. And of course, you can see if you've got a cataract, of course, that light isn't going to focus properly at the back of the eye. So this is why we want to be very protective. Okay, so what are some of the causes of cataracts? Let's go through the list really quickly. And here we go. Number one, if you're a smoker and you love smoking, this is something that you definitely want to increase that decrease of course, increasing your antioxidants, but decreasing the fact that maybe you're smoking. You may want to think twice about smoking because that is a big cause of that free radical damage in the lens of the eye and can lead to those cataracts. Okay, number 2 on the list, alcohol, unfortunately, is another cause for those cataracts. And it's not just binge drinking, even occasional drinking is going to increase that free radical damage. One of the things about alcohol is that it depletes your vitamin A very rapidly. And we know how important vitamin A is for the back of our eyes. When I get to my tips, I'm going to sort of tie this all together. But alcohol is something that is going to lead to potentially those cataracts. Okay, please hit that follow button. If you're new here, you're liking what you're seeing, you want a lot more natural health information, please make sure that you are following, that you are subscribed. It's all good to have you all here today. Okay, awesome. Let's continue on. And number 3, high blood sugar. So for those of you who know, maybe you're pre-diabetic, you're diabetic, you have difficulty balancing your blood glucose levels, this can lead to those cataracts as well. And there's an indirect link here as well. Did you know that all of the blue light, and we're going to be talking more about this, so all of the artificial lights, if you live an indoor life and you're inside all the time, those artificial lights and your screen time actually raises your blood glucose level without you even having to eat a carbohydrate. Now, how many of you knew that? If you knew that, please put a 1 in the comments, because I know that you're my follower because I've shared this before. Put a 1 in the comments if you knew that. Let's see who all my besties are who have followed me for a while. So yes, I will repeat that. You don't need to eat carbohydrates to raise your blood glucose levels. Just being under artificial light and being on a screen will raise your blood sugar. Yes, Raina, of course, Leanne, Browning, Sherry, yes, Tony, Safrina, Eleanor, Alice, Taylor, all my besties are in the house. Roberta, Farouz, thank you. Yes, Nancy, Ann, Jasmine, you knew that because you follow and you get all the best and latest good health information right here at the Dr. Janine Show. Okay, great. Okay, now the other thing is, of course, number 4, which is that blue light. And it's interesting that screen time is correlated to cataracts, of course, so not only your blood glucose levels, but that blue light and screen time is related to cataract formation, that clouding of the lens of the eye as well. And we're going to look at this study, and they found that that blue light causes the most cataracts at around the 460 nanometers. So they compared it up against UVA, UVB, sunlight exposure, and developing cataracts versus screens, and the screen time was worse than natural sunlight in your eyes, okay? So this is one of the reasons why I am always educating you about how to do things differently, and of course, in a way, sometimes that you haven't heard before in terms of helping with your health. And when we're focusing in now, let's talk about some of those symptoms, like how would you know if you haven't been to the eye doctor recently, maybe you've never had an eye exam, how would you know that you may have some of that clouding of the lens of the eye? Maybe you are developing a cataract and you didn't know it. Now, we will be talking about something called glyphosate in a few moments as well, and how that affects your gut health, how that's related to celiac disease and high glyphosate foods. That is coming up. Glyphosate is not a good thing. I'm going to be going through that list. Okay. How do you know that you may have that clouding of the lens, the cataracts? Let's go. Number 1, blurred vision. Okay, that goes without saying, because when you've got that clouding, when that light is coming in, it's going to scatter at the back of the eye. It's not going to have that nice concentrated focal point on the macula of the eye. That can be one of the symptoms of cataracts. Number 2, you see a lot of glare happening. Okay, this can happen at nighttime. This can happen, on a bright sunny day. Just everything, or our bright lights as well, everything sort of seems a little bit glary. Okay, number 3, at nighttime you're seeing halos. So you're seeing a halo around lights, the street lights. That can be cataracts as well. Okay, hit that share button, everyone. Thank you for everybody who's here today. I'm so glad to have you here. Thank you for tuning in. So many compliments coming in. Great to have you all here. Diva Organic is here as well. Marissa's Amaras Arden, I didn't say that correctly, but thank you for tuning in. Awesome to have you all here. Okay, let's continue with the list. How else do we know that we may have cataracts? You can't see well at night, so maybe you're, if you're night driving and it's getting more difficult for you, that can be a sign of those cataracts. And colors may start to seem a little bit faded. That is another very common symptom of those cataracts. Remember, the clouding of the lens of the eye. All right, now if you didn't know, I want you to screenshot that really quickly. If you didn't know that the Dr. Janine Show, if you're here for the first time, and I see so many new followers here, so thank you so much for that. Make sure you are subscribed and you are following so you always get my latest and greatest health information, of course, and it's all natural. Okay, this is a very interactive show if you're here for the first time, okay? So we have quiz questions, and we are at quiz question number 1 already, okay? So this is interactive. It's all fun and games, but at the same time, you can win a prize, and this is from our great sponsors at VitaTree Nutritionals, who sponsors, and of course, lets me come up here and talk to you and educate you every single week. This is the eye and vision support from VitaTree Nutritionals, and we thank our sponsor for letting me come out here and educate you and for supporting the show, as you all do when you tune in every week. Okay, is everybody ready? Now you're gonna have 30 seconds on the clock once you see that question come up. Most of today's questions are very simple, so you have a great chance. I will announce last week's winner in a few moments, so stay tuned for that. Is everybody ready to play? Just put your answers in the comments section. Are we ready? Here we go. Question number 1, true or false? Screen time is linked to cataracts. Okay, we're gonna bring up that clock. You've got 30 seconds. Get your answers in now. True or false? All right, 15 seconds left. This one's fairly simple, I think. And just take a stab at it if you're just tuning in now and you have no idea. That's all good, all good. Okay, we got 3 seconds left. Everybody got your answers in? I hope so. Yes, I see all those hearts coming in as well and all the love. Thank you so much. Okay, true or false? Yes, of course, the answer is true. So be very mindful of your screen time and the development of those cataracts, okay? There are some things that you can do to protect yourself. We will talk about that. I do want to announce, though, last week's winner of the VitaTree AccuBlood Sugar Balance, and that was Hanan Mahfouz, 1003. So congratulations, you were our winner last week. Now, everyone, please make sure on the different platforms that you are following Team Dr. Janine, because the worst thing is that you're picked as the winner. We randomly select all of our winners, but the worst thing is if we can't reach you, if we can't find you, you're not following me, you're not following Team Dr. Janine on some platforms, then we can't notify you as our winner and we have to pick someone else. So please make sure that you are always following Team Dr. Janine. All right? Okay, awesome, awesome, awesome. Now let's continue the conversation. I believe let me share now my tips and I'm gonna share my 7 tips for cataracts. We will be talking gut health as well today. So leaky gut syndrome and some of the causes of leaky gut and celiac disease as well. That was one of my viewer requests that you were asking for more information on some of my tips for celiac. Okay, so that is coming up. All right, so let's go and talk about now what can you do whether you've got the cataracts or definitely you want to prevent those cataracts from forming for your vision health. Let's go through my 7 tips. All right, so let's start with number 1, of course, is less screen time. Okay, so whatever you can do to maybe do more audio instead of video all the time. I know it's a conscious decision because I'm a visual learner. For me, it's very hard to learn just by hearing. I like to look at things, but if it's something that you don't necessarily always need to look at the screen at, then if you can put the screen away a little bit or turn it around and listen, try to do your best to decrease your screen time. The truth is a lot of times we're spending time on screens that we need not be spending that time on that screen, okay? So just think about that. Really important, especially for your eye health. Okay, tip number 2, of course, is you're gonna be wearing your blue light blocking glasses. Super important. Anytime that you're on a screen, you've got these on. You just have to make a conscious effort to always have them nearby. If you have to buy a few extra pairs, I probably have, like, no joke, like 10 pairs of blue light blocking glasses. They're everywhere. I have them in the kitchen at my house. I have them beside my bed for the evening time. And at the office, I've got them on my desk. I've got them here in the studio. Whenever you can, whenever you're on a screen, and for that matter, if you're under artificial lights, you're wearing your blue light blocking glasses, okay? Very, very important because they're going to block that damaging spectrum that has been found in the research that I showed you that study just earlier. That is going to protect you from that 460 nanometer light. Okay, you got to get a good pair that has been tested specifically for that wavelength between 400 and 500 nanometers that it's blocking that blue light wavelength. Okay, really important. Okay, number 3, make sure you're optimizing your DHA level. Does everybody know what DHA is? I hope so. It's the omega-3 fatty acid that we get from fish. And this is really important because now there has been some bad news about talking about fish oils. I don't know if you're in Canada, CTV, they did this big news article about, the woes of taking fish oil that can be damaging to your heart. Well, you always have to do your own research, and they've been trying to vilify fish oils probably for, 2 decades now. So always do your own research. DHA is super important because it concentrates, especially for your eye health, that DHA concentrates at those retinal cells at the back of the eye and even further back into closer to the brain, okay? So that combination of that DHA, natural sunlight coming into the eye, it's that DHA that helps to convert that natural sunlight into an electrical impulse in your body. This is what wakes up your brain, your entire nervous system, and all of your bodily functions, okay? So if you're lacking in that DHA, imagine that not only is your vision going to be compromised, but your entire nervous system, your entire body, all of your hormones, your ability to burn fat, okay? So this is really important. You've got to optimize your DHA levels. And for that, some people that means maybe, in eating more fatty fish, absolutely. For other people, it means taking a high DHA supplement, so fish oil supplement. Just always look for a good quality one. Actually, that's something that, have we talked about that in previous shows? Maybe that's something else that we can add to our roster in the next few weeks. Yeah, in terms of what to look for in a good fish oil supplement, we can review that, and I can update that based on some what I'm going to say misinformation out there as to how good or how bad fish oil is for your body. Okay, number 4 on the list, of course, is getting more red light. So yes, red light, when do we get red light? Naturally, of course, is from natural sunlight exposure. So first thing in the morning, as the sun is rising, you have an opportunity there, and especially as the sun is setting. Now, if you're concerned about the UV, there is no UV the first hour and the last hour of the day as the sun is rising, as the sun is setting. Okay, so this is really important for your eye health, is that red light is very healing and is so important. Now, I want everybody to hit that subscribe button because I know a lot of you watch the shows, you watch my content, you're eating it up, you love it, and you don't hit that subscribe button. And I want you to do that. Make sure you're following as well. I thank you for all my new people that are here today. A big shout out to you all. Love you all. Thank you, thank you, thank you for tuning in today. Okay, let's continue. What else can we do for cataracts? And remember, not only for if you do have cataracts, but also more importantly for prevention of cataracts, really important, lutein and zeaxanthin. Now, there's over 600 different carotenoids, these very specific antioxidants that exist in nature. 2 of them, only 2 of them, concentrate in the eyes. Guess which ones they are? They are lutein and zeaxanthin. And these can be found in like a high quality eye supporting supplement, something that is going to give you that high concentration. It does need to be whole food derived, so whole food based. Usually it's coming from the African marigold plant, so that beautiful flower has the lutein and the zeaxanthin, very protective for the back of the eye, for the macula, but for the lens of the eye as well, and helps to decrease that clouding of the lens and prevent it as well. Very specific antioxidants for that free radical damage, which is often the cause of those cataracts, remember, to begin with. Okay, mom always said, eat your carrots. Why? Well, carrots are loaded with beta carotene, which we know is super important. That converts to vitamin A, and our retinal cells, our eyes need that vitamin A. Really important for our eye vision, but very important antioxidant, of course, for preventing those cataracts. And number 7 on my list for cataracts and for good vision and eye health are specific herbal medicines. So things like bilberry, ribes nigrum, these are fantastic because they supply more of those antioxidants, more nutrition, more blood flow to the eyes to help with those cataracts and your vision in general for good eye health. Okay, I hope everybody got that list. Yes, thank you, thank you, thank you. Yeah, somebody's making the joke. Yeah, less screen time, but watching. Yeah, you still got to watch the Doctor Janine Show. Just put your blue blockers on, okay? And that will help to prevent against those cataracts. So I do want to shout out to all of my viewers. You're so wonderful every week that you are tuning in and you love the show and you comment on, a lot of my social media. In the interim, when I'm not actually live, then you're commenting on my posts and sharing such great, positivity, which I love. And that's what we're trying to build here is, the foundation of sharing good natural health tips. I love all of your questions as well. So please, I do want to shout out to all of my viewers that keep, sharing such great information. You guys are the best. Thank you, thank you, thank you. And continue to tune in every week. Okay, so this week we have Ross M. was our viewer spotlight that we're focusing in on. So thank you, Ross M. Thank you so much. Your information is life-saving. I'm so glad that you tune in, Ross. Thank you, thank you, thank you for all the positivity. Amazing, amazing. And hey, everyone, continue to share the love. Maybe next week you will be our viewer spotlight of the week. Okay, now let's continue on with migraines. So how many people get migraines? I know a lot of people, or headaches in general. If you've got a lot of headaches, you've got issues with, that chronic migraine that keeps coming back. It could be tension headaches as well. So these same tips would apply, whether it's migraines, tension headaches, a lot of spasm, and this is triggering your headaches. These tips are going to be really, really important. I will be talking about celiac disease, so that's coming up. I know a lot of you are waiting to see and to hear about my tips for that, and also glyphosate toxicity. That is coming up, and the high glyphosate foods to make sure that you're avoiding. Okay, that's going to be coming up as well. But let's talk about really quickly my 7 natural migraine relief tips. Okay, so these are things that you can do naturally. These are game changers. I heard, last week when I was on television here in Canada, some, great testimonials from people that have followed me for a number of years. I've been on television on that network for 15 years now with some great results and talking about headaches and chronic headaches and not having headaches again because they followed my tips and, dealt with some of their mineral deficiencies, which was a big thing, which we will talk about. It's one of my tips. Okay, so tip number 1 for migraines, of course, is limit your EMF exposure. Now, what are EMFs? If you're new to my content, electromagnetic fields and forces, anything that's plugged in, anything that has Wi-Fi or your cell phone signal, anything that is electromagnetic around you that's not natural, because yes, we have natural electromagnetism from the planets and of course the sun and the moon. I'm talking about man-made, it's called non-native EMFs. This can be devastating to your health, okay? And it could be causing you headaches. A lot of people are very sensitive to EMFs. You don't even know it. That's why I have a great podcast all about EMFs with the EMF guy, with Nick. So please make sure you check that out. But here you can see EMF exposure can be a direct link to causing migraine headaches. So please limit your EMFs. I've got a lot of content and, my posts about EMFs, just search up my name on whatever platform you choose and look up EMFs, my name, and you're going to see all of my tips there as well, specifically for the EMFs, okay? Now, if you're a migraine sufferer, magnesium bisglycinate. This is my favorite type of magnesium. Often migraine headaches are triggered by some muscle contractions, food sensitivities, and there's other triggers as well. But this can be very much related to a magnesium deficiency. And magnesium is a natural muscle relaxant and it helps to increase that proper balance between your calcium and your magnesium in your cells. When too much calcium floods in from, number 1, from your EMF exposure, that can trigger the headaches, okay? So magnesium is a natural calcium channel blocker. You want to get the right type of magnesium. This can be a game changer. I've helped so many people, in my practice over the years, just with this one supplement alone, no more migraines. They completely disappear. We actually have one of our followers, I don't know if you're tuning in today, who has no more headaches because of following just this one tip, all right? Okay, number 3, another mineral, super important if you're prone to migraines, is iron. So if you have an iron deficiency, make sure that you're taking the right type of iron. And that's why I love the iron bisglycinate. That's a future show as well that we'll make a note on this, because I think a lot of people take the wrong type of iron. You got to know what to look for in a good iron supplement. That will help with those migraines as well, especially if you're deficient in iron. Okay, number 4, of course, is fix your leptin resistance. So we know that leptin, where's Where's Mr. Fat? Real quick. Okay, let me just run over here for a second. I know you don't have to follow me. Yeah, I'm back. Okay, so leptin. What is leptin? This is all about balancing our hormones. Leptin resistance is something that can very much be causing your migraine headaches because it's inflammatory, okay? When you've got leptin resistance, it's one thing to not be able to lose the weight, but it's very inflammatory to be going through this entire process with the leptin resistance. I've got a ton more content on leptin resistance. You can check it out. Hey, and make sure that you are subscribed, that you're following, so that you always are in tune with what's going on in terms of getting the best natural health information. Okay, let's go on. Number 5. Limit your carbohydrates. That ties in with your insulin resistance, but also the leptin resistance. When you're spiking your blood glucose all the time, unfortunately, that leads to the leptin resistance and then the insulin resistance, and now things are not balanced. You're going to be crashing with low blood sugar. You could be spiking with high blood sugar. That, of course, can trigger those migraines, and they keep coming back and back, and you can't find that resolve. That's why limiting your carbohydrates is going to be important, as well as number 6 on the list, doing that full body detox, getting those toxins out, cleansing the internal organs. Remember, when we're detoxifying, we don't want to just focus in on one organ system like a liver cleanse or just a kidney cleanse or just a gut cleanse. We want to make sure it's a full body detox, eliminating all of those toxins at once, plus through the blood, the lymphatic system. That's really important for alleviating those migraines for good. Again, as a naturopathic doctor, I like to focus in on what is the root cause. Why are you getting the migraines? It's not a deficiency of your migraine drug. Okay, you have to think about this. It is something deeper down is triggering it. For a lot of people, that toxicity is one of the big causative agents for those chronic headaches. And whether it's migraines, like I said earlier, if you're just tuning in now, it could be, the tension headaches, any type of headache. It's not normal ever to have a headache, okay? That's your body's telling you something. And for chronic, any type of headache, often I found in my patients over the years that it has to do with that internal toxicity. You do that full body detox. I recommend it, a few times a year, at least once per season if you can. Get those toxins out, you're going to feel so much better. No more headaches. All right? And number 7, doing some acupressure. Okay, so let's do this all together. If you're prone to headaches, I want you to find this point, and it's related to your large intestine. Okay, you can see it here. So all you're going to do is put your hand like this, and you're going to use your other hand and use your thumb of your other hand. And where your thumb basically lines up, it's at where these bones sort of create that V between your first finger and your thumb. There's a point there, and it's called large intestine 4. It is related to your large intestine. This is one of the reasons why if you have constipation and your poops aren't great, so maybe we'll take a look at those poops really quickly. If your poops aren't great and you're constipated, that's why you sometimes get a headache. Have you ever noticed that? And once you poop, the headache goes away? Has anybody ever noticed that? So if you've got the poops that are looking like this, you've got severe constipation. So what I call the meatball poop, or maybe you've got the rabbit pellet type of poop, or maybe you've got this type of poop happening because you also have a blockage, so poop isn't flowing through the digestive tract really great, so this one has to sort of get by. And you've got the pencil-like poops. These can all be indicators, of course, that you've got some of that toxicity, that full body detox. But using this point, this is the master point in traditional Chinese medicine in terms of all of your qi and the meridians related to your large intestine, but the master head point as well. So it is, distal to your head, right? Doesn't seem related, but it is very much related energetically, okay? So by pressing on that point, and you're gonna find it, so you gotta sort of move around, and the direction of the pressure is across your hand, okay? So it's one thing to find the point and you're poking around, I don't feel too much, but it's like, for me, it's like right about there, and the direction of I'm pressing, it sort of causes an ache through my hand. You're pressing, and the intention of the way that you're pushing is across the hand this way, and fantastic. So if you do have a headache or you've got, some tension building up in your shoulders, you're gonna press LI4, amazing master point for your head. All right, there you go. Got it? Okay, awesome. Now let's continue. Let's talk about some more gut health issues and causes of leaky gut. Now, we will be going back to the beauty set in just a second, and we'll be talking about, of course, our eyes and face taping for our eyes, those crow's feet, that is coming up, those little wrinkles around the eyes, if you at all care. But it's a great segment, okay? So I know a lot of you are waiting on that. Okay, let's talk about Causes of leaky gut, all right? So these can be, because we will be talking a little bit about celiac disease, these can be partially related to that celiac, okay? So here we go. Lack of sun. So I've talked about this in previous episodes. Your gut microbiome and all of the good guys in your gut are very much connected to your outer environment. And if you're not getting enough natural sunlight, then there's chaos. There's a mismatch between the clocks, or circadian clocks, in all of your gut cells and in your microbiome as they're related to our universe and the sun and the light and the dark and the cold and the hot of the day, okay? So this is really important. Lack of natural sunlight exposure. Most of us cover up, right? We're indoors a lot of the time. We're not getting out in the sun. We wear sunglasses. We put on our sunscreen. We're not getting sunlight. You have to get sunlight, especially if you've got a lot of gut health issues, leaky gut. Make sure that you're getting out into that natural sunlight exposure. Even on an overcast day, just natural light outside is going to do wonders for your gut health. Okay, number 2. Blue light is another cause of that leaky gut syndrome. We know this, and that goes along with number 3, that EMF exposure. So there are a lot of research is actually going into now EMFs and leaky gut, how that affects the microbiome in a not so good way, which is number 4 on my list, of course, that unhealthy microbiome. So when we've got good gut bugs, all right, not this situation. What's happening here? We've got a lot of parasites, candida, bad bacteria. They're taking over. Not a good situation. We want to have enough of the good guys, our probiotics, and that's exactly what probiotics are. Pro meaning good, biotics, live microorganisms. We need to have enough of those taking over so that if one of those bad guys tries to get in, it's crowded out because we've got enough of our good guys. So this is unhealthy microbiome. It's a bad situation. You got gas, you got bloating, you've got autoimmune disorders, you've got a lot of issues with your gut health, not a good situation. You've got to have that healthy microbiome, and part of that is, of course, getting enough good guys, your probiotics. Hey, hit that share button, everyone. Thank you for all the love coming in. I see all those hearts coming in. Thank you, Bozena Wilk 82, thank you for following. Jay Carruthers 1985, thank you for following. Rena 8 Kids, thank you for following. Oh my goodness, thank you for taking time out of your busy day. Awesome. Yes, just shared. Thank you. Sherry just shared, and a bunch of you just shared. So user 293 and a bunch of numbers. Thank you, thank you, thank you for tuning in today. It's so great to have you here. Make sure that you are following, that you are subscribed, so that, because a lot of you watch the show and then you don't know when the next new thing is coming up or the next new show. I want you to get all of my reminders, okay? So make sure that you are following, that you are subscribed. Let's continue. What else causes that leaky gut? So if you've got a lot of gut health issues, gas, bloating, glyphosate. So we're going to talk about some high glyphosate foods. If you don't know what this is, it is commonly used here in North America, probably all over the world as well. They've tested the blood of, lots of people all over the world. Everybody has glyphosate in their blood. It's a herbicide. It's toxic, and it causes leaky gut syndrome, okay? So it opens up these tight junctions in the gut. That's what leaky gut is tight junctions open up, caused by that irritation by this very toxic herbicide, glyphosate, okay? So something that we definitely have to avoid. I've got some high glyphosate foods to avoid coming up in just a second, and you can screenshot that list, which is important. Okay, number 6 is medications, some like the non-steroidal anti-inflammatories. So you're taking something for your back pain, or you're taking something, we just talked about migraines, you're taking something for your migraine headaches, ibuprofen, acetaminophen, that actually can cause that leaky gut, okay? It's causing inflammation in the gut, some microbleeding, and can damage those tight junctions and lead to leaky gut syndrome and cause a lot of gut issues. So I want you to start to make those connections for yourself. Maybe you have a friend who gets headaches or migraines all the time. They definitely need to watch the show because we talked about both, and maybe they're taking some over-the-counter, stuff. They go to the drugstore, they're always taking their headache medication, and they stress out if they don't have it. Well, did you know that that's then part and parcel of their gut issues now, and they've got the gas, the bloating, and gut issues. So you can see how everything is tied together. That's why I'm all about doing things more naturally, okay? So medications can also cause that leaky gut, especially the non-steroidal so the painkillers. And number 7, stress. We know that stress is so correlated to what's going on with our health in general, but especially for our gut health. So it's something I want you to be mindful of. I do have another Be Still channel, so check that out, which has very, balancing frequencies and fantastic relaxing meditation music. So that's something that you can check out. But whatever it means to you, getting outside, relaxing, taking some deep breaths, doing some meditation, some manifestation, whatever it means to you, you've got to decrease that stress and decrease that internal inflammation, that internal chaotic storm that's happening. That's why getting out into nature can help to counteract that stress, okay? Question number 2. Okay, we're already at quiz question number 2. Is everybody ready? We're playing for the eye and vision support from our great sponsors at VitaTree Nutritionals. Is everybody ready? I think everybody knows the drill. All right, you're going to have 30 seconds. You're going to get your answers in. Please make sure that you are subscribed, that you're following, and I want you to subscribe so you never miss any of my great information. Okay, are you ready? Okay, quiz question number 2. Here we go. Name a mineral deficiency linked to migraines. This is something that we just spoke about in the show. Please make sure that you are getting your answers in really quickly. All right, looking forward to seeing these answers. Let's see who is paying attention, who's been here for a while since, towards the beginning of the show. All right, you got about 10 seconds left. Everybody getting your, I'm liking what I'm seeing. This is very good. Amazing, amazing. All right, everybody got your answers in. I like the fact that, yes, okay, this is very, very good. Rosa was very specific. I like that. Yes, of course. Okay, so the 2 minerals that can be linked to those migraine headaches, magnesium deficiency, very, very common, and iron deficiency as well. So this is something that you definitely have to maximize your, of course, intake of these 2, and magnesium bisglycinate, iron bisglycinate are my favorites. Okay, let's talk a little bit about that gut health. All right, so do you know what this is? I use this on TV when I'm on TV. Does this look familiar? This represents your gut, and we've got lots of gut, 8 to 10 feet of gut inside our digestive tract. Okay, so imagine that's a really long tube. If we were to stretch it out, how important that is that we're actually taking care of, especially those tight junctions between, and imagine this is a tight junction between my little, cottony bally things. Those tight junctions need to be strong so that we don't have leaky gut. We did go through, some of those examples of leaky gut, but here we go. And what causes that leaky gut? But did you know that glyphosate? So glyphosate is a herbicide, and it's commonly used in killing pesticides. It's commonly used in certain crops. And I'm going to give you a guess. If you eat this for your breakfast, okay, and it's not organic, you're getting a good dose of glyphosate. And anything that has oats in it, we're going to go through the foods that are highest in that glyphosate. But here's what the research shows, okay, and this gets a little bit wordy. But there is a link between celiac disease, because I promised I would answer this for you, because I know a few of you were asking last week for me to talk about celiac disease. Has anybody ever told you this? The link between glyphosate, okay, and celiac. Now, in this paper, we have systematically shown how these features of celiac disease can be explained by glyphosate's known properties. And this is disrupting the shikimate pathway, okay, altering the balance between pathogens and beneficial microbiota in the gut. So that's the healthy microbiome that I was talking about with leaky gut. We can come back and take a look at that in a second. Chelate and transition metals, sulfur and selenium, not a good thing. And glyphosate does block up glycine, and that's why I like the magnesium bisglycinate, iron bisglycinate when we're talking about supplementing with the right types of minerals. So this is important. And inhibiting cytochrome P450, which is, a very detoxifying enzyme system that works on our behalf. So, and then they say, and they go on to say that they argue that this key system-wide pathology, as it's related to glyphosate, there definitely is a correlation with celiac disease, okay? So it's not just me saying it. This is something you can do a lot more research on your own. If you do have celiac and you're the nerdy type who likes to research all of these studies and things, the evidence is out there. So please go and look at that study more specifically. You can look it up. Really important. So please hit that share button. Thank you for tuning in today. Really quickly with that microbiome, what we were talking about is getting that proper balance of your good and bad gut flora. And here's the thing, when you're eating something like this, we're going to go through the foods that are highest in that glyphosate, which is very toxic to that gut and can be related, of course, to that celiac disease. When you're eating foods like this, unfortunately, it messes up that leaky gut. It messes up those tight junctions in the gut. And now you don't have enough of your good guys, your probiotics. You've got more of the bad guys taking over. And this is why I talk a lot about parasites and candida and a lot of chronic gut issues, why we have to clean up that healthy microbiome. Okay, let's go through the 7 foods that are high in glyphosate. Some of these are seemingly healthy foods, and that's the unfortunate part. If they're not organic, very high in glyphosate. Okay, so you can guess what number 1 is on the list. Of course, is oats. Yeah, so oats, just in modern farming, especially here in North America, they're using glyphosate. Now, what glyphosate does is it kills the pests and the other herbs and things that what they don't want growing, and it allows for that whatever grain crop that they want to flourish. It really allows for that to flourish very quickly, and they get an abundance. It cuts down the costs, and then of course they get more crop for less money. Okay, so oats. And I'm not just talking eating oatmeal, I'm talking granola bars, I'm talking cereal. So you got to be very mindful. If it's not organic and you're feeding your kids, oatmeal for breakfast, or anybody really for that matter, a breakfast cereal that has oats in it, glyphosate. I want you to start thinking in this way, okay, and make just healthier choices. Okay, number 2, the big one, why does everybody have issues with wheat? Why do celiacs have issue with wheat? Yes, celiacs also happen to have issues with corn. So are we making some connections here? Yes, with the glyphosate? I hope so, okay? Number 3, of course, is corn. Number 4 is, of course, orange juice even has been found. So they tested orange juice from different brands, of course, that you're buying in the grocery store, contaminated with glyphosate as well. Okay, aren't you loving this information? Please make sure that you're subscribed, you're following, so that you can continue to get all this great health information. Okay, let's continue the list. You can screenshot this when I get to the end. Crackers, so most crackers are made from what? They're made from wheat. Sometimes if they're gluten-free, they're made from corn, but you're still gonna get that glyphosate issue. And this is why the gut doesn't heal, because you're still inundating the body with that glyphosate. Okay, so crackers, you gotta be careful. Unless, of course, you're making your own and they're organic, okay? Number 6, cookies. So we're talking packaged cookies, the ones that all of the kids love, that are not to mention completely addictive because of the food scientists and all the other chemicals and stuff that they put in there. But yeah, cookies loaded with glyphosate, they've tested these as well. And unfortunately, yeah, wine you would think is a healthy thing to drink once in a while. Maybe not so much because of the glyphosate. So you may want to consider organic wine, especially if you know that you have gut health issues, okay? So this is something that is important. If you've got celiac, you want to think about these things. Okay, does everybody get that list? You've got it? All right, I do want to say thank you to my super fans. Thank you so much. I love the fact that you tune in every week and you're so generous, and a lot of you are donating as well, which is so fantastic. Thank you so much, and continue to share the love. I can't always call everyone out during the show, during the live show, as you can imagine, but I do appreciate all of you. Okay, we are going to the beauty set now. We are going to do some face taping. I know a lot of you have been waiting since the beginning of the show for me to talk about face taping. Now, a lot of you wanted to know about the eye area and how we can do some face taping for the eye area. So a quick review if you haven't been with us the last couple of weeks. The face tape is kinesiology tape. Put a 2 in the comments, everybody, if you're doing your face taping at home now, since you've started to learn this on the Dr. Janine Show. Okay, so the kinesiology tape is something that you purchase either online. It's probably the fastest way to get it. At the pharmacy, you could buy it as well. And you're just going to cut off little strips, okay? And it does have a backing on, and it's an adhesive. So what I want you to do is a little patch test to make sure, the day before, you're going to just make sure that you're not reacting to that adhesive on the tape. And you just peel off the back, basically, and you're going to put it on your wrist, and you're going to leave it there maybe 20 minutes, 30 minutes. Peel it off, make sure that you don't have a rash, because some people are super sensitive. I find, and I do have sensitive skin myself, I find I have no problem with the kinesiology tape, but I do want you to experiment. And of course, it comes in all different colors. The first time I bought it, I bought like the hockey, black one, and I put it on my face at nighttime, and the kids are like, "Mom, what happened to your face?" I'm like, You can get the one that's like more closely matching your skin tone as well. You don't have to go with black or like the bright blue, but hey, it's fun. And I like to do it when I'm on screen, which is fun. Okay, so with the face tape now around, we know that that tissue around the eyes is very delicate. And if you're starting to see those smile lines, which I think are fantastic, it means that you're living a good and happy and healthy life to have those smile lines. If you care or you don't care, it doesn't matter. I'm just going to share the technique, but this is great. If you want to sort of slow down that wrinkling process around the eyes, all you're going to do on clean skin, and I like to do this at bedtime, clean skin, you're not going to be able to put on your moisturizers, your castor oil, or all those other things that I share, because of course the adhesive isn't going to stick. And you can experiment, because some people can put on a serum depending on the serum and it will soak in really well, and then you can still have some adhesive properties. So that's a question that came up, you know, if your serum or whatever goes in and your body absorbs it really well and it's not sticky on the outside or slippery on the outside, then go ahead, then do that. Everybody's skin is going to be different and your serums are all different. So I just want to say that as a caveat, okay? But this is something that you can do. So all you're going to do is sort of spread out and even out if you have some wrinkles here. So with your fingers, you're just sort of spreading out your skin. And what we're doing here is we're effectively helping to decrease any wrinkling, but also sort of slowing down that muscular contraction around the eyes. Much like when we talked last week about Botox, what Botox does is it sort of shuts down that muscle function, and then you get nice relaxed skin, and then you have, of course, less wrinkles. The same with the kinesiology tape. Now this is, of course, not as long acting. It's working as you're sleeping and relaxing, but more important, and what I've noticed over time with using the tape, is that it's making a brain connection, and you tend to sort of squinch your muscles a little bit less in the facial muscles, and that can help to slow down that wrinkling process over time, okay? Just one of the mechanisms. So here you go. So of course we have the orbicularis oculi, that big muscle around the eyes, and depending on, you know, our zygomaticus as well, how much we're smiling and talking, and, you know, if you really use your eyes a lot and you're very expressive like I am, then you might, you know, you may start to see some lines and things happening. All right, so all you're gonna do is spread out your skin with your fingers like I show you here. It helps to have a mirror, and then you just basically apply the tape to that area and pat it down gently. I didn't really apply any stretch. So in some of our techniques with the face taping, we apply stretch. In this case, I'm just wanting to lie it down on my nice flat skin, because that even has a lifting effect. So in the morning, and then you go to bed and sleep, and you put on your eye mask and you have a lovely night's rest, of course, secrete your own melatonin, and doing that naturally because you saw that early morning sunlight, all of those other tips that I share. Okay, you're gonna apply that and go to bed. And then in the morning, you're gonna notice, and this is the best thing, it's like a reveal in the morning. So when you gently peel off that tape in the morning, it sort of is lifting up that skin, and your skin just looks like glass. I mean, it is amazing, because that adhesive was on the flattened skin. You lift that off. So that has a nice lifting effect first thing in the morning. Then you do your whole whatever routine that you have, of course, for your face, and then you start your day. So make sure that you are subscribed if you want more information like this. And okay, kinesiology tape. Can I write it on here? I don't know. Let me try to write it on. Can I get like a more blank screen? Here we see. Let's see. Kinesi. There. Kinesiology tape. Is that legible-ish? Yes? K-I-N. This is an N. Oh my goodness. My children would watch me and it's like, Mom, you can't read that. There we go. All right. Got it? Kinesiology tape. We got it? Okay, good. Awesome. All right. I hope everybody got that real quick. We can come back to it in just a second if you really need it, because we have to move on to quiz question number 3. So if you're just tuning in, I'm Dr. Janine. Nice to meet you. Please say hello. Thank you for all of those great comments coming in. Kinesiology tape, that's what it's called. Yes, yes, yes. You can buy any one really online. It's not too expensive. I see some people questioning. And there are different types of tape that you can use. I can talk about it in a future show. Okay, so we're playing, everybody. We are playing. This is our third quiz question for today. We are playing for the Eye and Vision support from our great sponsors at VitaTree, Whole Food Vitamins. All right, are we ready? Here we go. Name a herbicide linked to celiac disease. Okay, just guess if you don't know, if you're just tuning in now. But those of you who have been here for the entire show, you should know what the answer is. Get your answers in quickly. All right, good luck, everyone. All right, we've got about 10 seconds left, everyone. Let's see, how's everybody doing? Okay, some people, yeah, a lot of people got it. Woo, this is good. Rosa. And all right, Shelly, Eladia, Leanne, Zachary, Lynn, Miller Time, Lisa, Kathy, Sandy, almost Bella, Daniel, Jacinth, triple purple hearts, Lorem, David, user 293, user 934, Carrie, Emma, Ms. Dielsen, and is it NM37865? Good job, everyone. Jill, Trish, more questions coming in. Yes, I wanted the name of the actual toxic herbicide. Of course, let's reveal. Here we go. Of course, it is glyphosate. Yeah, so something, and you're never going to see this on a label that it's labeled glyphosate is in there. You just have to be aware, and that's why I educated you with that list. If you missed that list, we can pull it up again. And more importantly, tomorrow we can pull it up, okay, and we'll go through the list again tomorrow. But really quickly, the 7 foods that are highest in glyphosate, you got to watch these. If they're not organic, you can most likely, depending on where you live, I know a lot of you are in the US and Canada, but from people all over the world, most time there's going to be some glyphosate, okay? Unless maybe in Europe, if you're on the mountains overlooking the ocean, because they don't allow it over there in certain European countries. All right, so please tune in tomorrow, though. So, of course, our live shows every Tuesday. Wednesdays, if I didn't get to your question, Wednesdays at 1 p.m. Eastern Standard Time. So that's tomorrow at 1 p.m. Eastern. Please make sure you're tuning in. You can ask me any question that was related on today's show, okay? Because that is important. I want to be able to, and we can review some of what we went through today. And talking about whether it's the face taping, we can go through some of those techniques that I've shared in previous shows. We can talk more about celiac. I see some, Tracy, I know that there's some questions and some comments coming in here about celiac as well. So we can go through that. We can go through the eye health and the list of, some of the things that I really like to target that good eye health. And that is something that we'll do tomorrow at 1 p.m. Eastern Standard Time. And the migraine tips. Okay, we want to see the migraine tips really quickly. Okay, let's take a look at those really fast. So if you do have headaches, so not just migraines, headache relief, if you do have those migraines, here's my tips. Of course, limit that EMF exposure, magnesium bisglycinate, iron bisglycinate. So these forms of these minerals as supplements, really, really important, because that glycine, really quickly, that glycine helps to counteract what was lost with the glyphosate. Okay, so there's some correlations here with the celiac and the leaky gut and that glyphosate and the type of mineral that you're actually ingesting. Fix your leptin resistance, limit your carbohydrates, full body detox, and use that acupressure point. At the first inkling of that you're not feeling great, you think that, I'm getting, and a lot of people that do have migraines, you actually get the aura and you're sensitive to smell and light and all these things. Start with that point immediately, okay? Immediately. All right, there you go. Thank you for everybody who is tuning in right now. It's so great to see you. I am Dr. Janine. It is a pleasure to always be able to interact with you on Tuesdays during the Doctor Janine Show. Fantastic that you've all tuned in. If you're just tuning in, we did talk so far today about migraines. We talked about eye health and cataracts. We talked a little bit about leaky gut syndrome. Of course, that glyphosate, that toxic ingredient that unfortunately they use in modern agriculture with the most, commonly eaten crops like the corn and the wheat and the oats, unfortunately. And that's how there's a link then back to celiac and gluten sensitivities because of the glyphosate. And that's actually in the research. So that is something that you can learn more about. Now, if you want to make sure that you're setting your timers, setting your reminders for next week's show, where we're going to be talking a little bit more about gut health and candida. I'm going to talk about thyroid health, as well as the best and worst foods for your hair growth. And maybe we'll talk some supplements there as well. What you can really take to target that hair growth if you're struggling, or if you know somebody who's struggling with their hair growth, or you just want longer, fuller, more beautiful hair. That's something that we're going to talk about next week. Thank you everybody who tuned in today. It was so great to have you all here. And make sure you tune in tomorrow at 1 p.m. for our Q&A. And I'll also see you next week. Check out all my content. In the meantime, make sure you are subscribed and following so you get all of those notifications as well. We'll see you then. Bye.